Hi, I'm Dr. Tabatha, the functional gynecologist. I'm a board-certified OBGYN and functional medicine physician. I've embraced the world of functional medicine and wellness through my own personal health journey, and I'm super excited to share my wisdom and unique perspective as it pertains to women's health. So if you're struggling with hormone imbalance, weight gain, period issues, anxiety, insomnia, you name it, then you've come to the right place. I want to be your functional gynecologist. So welcome. Hi friends, I'm so excited about today. We are going to be talking about something super important, fibromyalgia. So even if you haven't been diagnosed with this, I still think you're going to want to listen to this episode today because the symptoms that are associated with this diagnosis are rampant. Like, we all could probably check the boxes on these symptoms: anxiety or depression, fatigue, joint pain, muscle aches. The list goes on and on. I was at a point in my life where I actually thought I had fibromyalgia and was on that path to finding a physician to diagnose me when I stumbled upon functional medicine and realized the root cause of my issues. And what I realized was fibromyalgia is a constellation of symptoms. It's not really figuring out the root cause of your issues. And when I met my guest today, I was just so excited to hear that he is treating fibromyalgia from a functional medicine standpoint. He realizes that labeling you with a disease based on a bunch of symptoms and then finding a corresponding drug to treat it is not going to heal you. It's not going to get you well in the long term. It's not going to get rid of your pain or make you feel better. So if you yourself aren't dealing with this, you might very well have someone in your life that you know who is struggling and dealing with these issues. So I'm really excited to talk to Dr. Rodger Murphree. So please stay with me for this whole episode. And like I've said before, if you don't have time to listen to the whole thing now, the beauty about the podcast is you can hit pause and come back later. You can come back the next day, next week, whenever you have time. I love listening to podcasts for that reason, because you can always pick up where you left off. You can listen again if you feel like you missed something. You're like, hey, what were they saying? That was really interesting, but I don't remember the details. You can listen again. We are here for you. So please listen to this episode as I interview Dr. Rodger Murphree. Welcome, Dr. Murphree, to the Functional Gynecologist Podcast.
Hey, I'm so excited to be here. This is going to be a lot of fun.
Yeah, I'm super excited too, because you have something awesome coming out that you've been working so hard on, the Fibro Summit, right?
Oh yeah, so it's 9 months of intense love and joy, blood and sweat. But no, it's the Fibro Summit is a labor of love. I'm just really excited about the opportunity to share that information with individuals who are looking for answers and haven't been able to find them.
That is wonderful. I think there's so many people suffering out there, women especially. I see them so often. They've run the gamut of doctors, right? They've had all the tests that come back normal, and then they find someone like you, and you actually have success at helping them, right?
Fortunately, I do, and I've been doing it for 20 years, so I've had some practice, some trial and error, but yeah, it would be difficult. I mean, just putting myself in their shoes, as I often try to do, and then I'm sure you encounter these patients as well. They've kind of been everywhere and tried everything. They're kind of they get on the medical merry-go-round, one doctor after the next, and it's really a frustrating illness to have because there's not many doctors that understand it.
Yeah. So explain what the most common symptoms are. What are people coming to you complaining of?
So for those of you who don't know what fibromyalgia is, and there's probably a lot of people that still don't. I mean, I get that question a lot. What is fibromyalgia? Fibromyalgia syndrome, it's a group of symptoms that people have in common. So diffuse, achy, sometimes disabling pain, exhaustion, fatigue, brain fog, where you can't, mental clarity is off. Um, Oftentimes they have low moods and anxiety, restless leg syndrome, and irritable bowel syndrome. These are the common symptoms we see with fibromyalgia.
Okay. And, that list of symptoms is so common for other things that women suffer from, right? Like hormonal imbalance and thyroid disorders. They probably have. Do you find that when women come to you, they've already had all that ruled out or not necessarily had a good evaluation done?
Oh, yeah, Tabitha. So what I see is typically by the time they find me, they've been to half a dozen doctors, and over typically 3 or 4 years, they've had all these different tests done to rule out autoimmune disease or MS, thyroid issues, and then finally they they run the gamut of all these different doctors, and then finally someone puts the rubber stamp on their forehead that says, "Hey, I think you got fibromyalgia." And then the problem is once they get that diagnosis, it follows them the rest of their life, and they're treated differently.
Yeah.
And so from a patient standpoint, you want to know what the heck's the matter with you, right? So you want someone to be able to tell you, oh yeah, you have this. So when they get the diagnosis, the first reaction a lot of times is, thank goodness someone finally tells me that I've got something, I'm not crazy. But then what they find out is the conventional treatment for it is typically just learn to live with it. Here's some, a few drugs that we've got to suppress the symptoms. That's unfortunately kind of common in conventional medicine. And, but, you just have to learn to live with it.
Yeah. So tell me, why do you think some women develop fibromyalgia?
No, it's interesting, and I think you would find this interesting. I know when you did a great job. So I was really excited to have you on the summit, the Fibro Summit. Um, we talked a little bit about this, about why women. Why is it fibromyalgia affects women typically between the age of 40 and into their late 60s, early 70s, and the question is always, well, why is women? Why is it 98% of people have fibro are women? And obviously, the first place you're going to think is hormones, right? And so I really think there's something with estrogen and progesterone that we've not found, that I think is probably there. But the other hormone that I think is the common denominator for fibromyalgia is serotonin. So serotonin, this brain chemical, I find in working with fibromyalgia patients, either men or women, I find that for women, typically they get low in serotonin. So if they have anxiety or depression, they're low in serotonin.
Mm-hmm.
Men tend to get low in norepinephrine, another brain chemical. And this is research I did years ago, writing another book that I wrote, Treating and Beating Anxiety and Depression. Now, whether that is scientifically valid, I don't really see that in the literature, although people do speculate about that. But when you get low in serotonin, you lower your pain threshold, so pain becomes more magnified. And that really is the driving force of fibromyalgia, is that their pain threshold is low, and so pain is magnified, and it doesn't matter what's triggering that pain. It can be osteoarthritis, wear and tear, degeneration. It can be an autoimmune disease, autoimmune arthritis like Sjogren's or Reiter's. It can be osteoporosis, bone loss. It can be old scar tissue. But once that pain threshold is lowered, and they also develop a thing called central pain sensitivity, where their nervous system is overloaded. It takes in stimuli, and it's accentuated, including the pain stimuli. So they experience pain in a magnified way that others don't.
Yeah. I think you're right on with all of that. And, the drug companies realize that as well, because now they market the antidepressants, the serotonin reuptake inhibitors for pain management, right, of these illnesses. So do you find that the pharmaceuticals help with fibromyalgia, or we need to go deeper and get to the root cause?
You know so well as a functional medicine practitioner, really what you want to do is you want to find and fix the underlying causes of these symptoms, no matter what the illness. And in fibromyalgia, one of the real problems or challenges is there's so many dadgum symptoms.
Yeah.
They have trouble. I didn't mention this earlier, but they have trouble with their sleep. The brain fog I mentioned, the IBS, the problems with loose bowel movements or constipation or stomach pain or the chronic pain, the low energy. If you go the conventional route, which is all about suppressing symptoms with medications, there's just too many symptoms to suppress. So before you know it, with fibromyalgia, you're on half a dozen to a dozen drugs. You're a drug to put you asleep, a drug to wake you up, a drug to speed you up, a drug to slow you down. I mean, it's a recipe for disaster. You cannot drug your way out of fibromyalgia. In fact, I would say, Tabatha, that drug therapy is a hindrance to getting over fibromyalgia. It actually creates more problems than it helps. At least long term. I'm not anti-drug. I'm not. Thank goodness we have them. Thank goodness. But in a chronic condition like fibro, the only way to feel good again and to stay that way is you've got to get healthy. And drugs, they, at least long term, they don't make you healthy. Now they can be life-saving, no doubt about it. And sometimes they are your only option, and sometimes even your best option. But with a chronic illness like fibro, it just creates more problems.
Yeah, I would totally agree. I mean, I was going down that path. I could see being labeled fibromyalgia in my own future. And so this really hits home for me, because having Hashimoto's autoimmune thyroiditis at age 18, having Raynaud's syndrome, having IBS, having all of these chronic problems, chronic knee pain, chronic joint pain, like the list kept getting bigger and bigger, and I was only in my 30s by this point on all these medicines. I saw, my future being called fibromyalgia, because I was to the point where I couldn't function. I was in so much pain. I was so exhausted, like all of those symptoms you're describing, right? So I feel like women can go down two paths. They can go down yep, you have fibromyalgia, here's some drugs to mask your symptoms, or you can go down the path of, how did I get here? What are my root issues that I need to address and reevaluate, because that's what I did. I completely revamped my diet and my life. I started sleeping again. I stopped eating processed foods. I got rid of my crazy job stressors. And when I reclaimed my own health, all of those symptoms started dissipating, right? Like, I still get some of that stuff every now and then, but it's not my daily life. It doesn't consume me. It doesn't run my life. It's more of a, I do something stupid and I pay the price now. So I feel like there's so much hope for women with these list of symptoms or this label of fibromyalgia. And I feel like you have done such a great job at like showing them, here is the answer, here's the solution, right? So explain to me a little bit about your Murphree Method.
So it's real original, the Murphree. Someone told me one time, Dr. Murphree, you need to coin, your protocol, something that people can remember you by. And, I racked my brain forever, and just finally, I think one of my assistants said, it's the Murphree Method. It's just what you've done forever. So, but the Murphree Method is really based on what you and I have been trained on in functional medicine. And it's really based on finding and fixing the underlying causes of the symptoms. And that's really that sounds simplistic in a way. It's kind of like when I say, I always tell people that, the only way, I mentioned this earlier, the only way to feel good is you got to get healthy. But that means different things to different people. But look at, if you've got a symptom, if you kind of think about this, it totally makes sense. A symptom is a warning sign. That's all it is. That something's gone wrong in your body's ability to operate correctly. We're healing dynamos. We have a new stomach lining every 3 days with the actual surface cells that contact food being renewed every 5 minutes. It's amazing. It's amazing. But with the Murphree method, it's really about finding and fixing the underlying causes. And the place to start for fibromyalgia, and I think really by anybody with a chronic illness, is making sure that they're getting deep restorative sleep. Yeah. That's number one, because if they're not getting deep restorative sleep, they're going to deplete their stress coping chemicals. And when they deplete their chemicals like serotonin, now they lower their pain threshold. Serotonin is the happy hormone. So when your serotonin is compromised, you tend to be a little more anxious, can have problems with low moods. You have more serotonin receptors in your intestinal tract than you do in your brain. So you can have problems with IBS when you get low. You can't regulate your bowel movements. Then number two, so it's sleep's number one, making sure you're filling up your stress coping savings account with deep restorative sleep each night. Then number two is fixing any problems with our hormones, the adrenal glands, the thyroid, these glands that help the body work like it's supposed to. I find that 70% of my patients with fibromyalgia have something wrong with their thyroid, and 85% have something wrong with their stress coping glands, the adrenal glands. Then number three, I really believe with fibromyalgia, you have to saturate the cells with high doses of vitamins, minerals, amino acids, and essential fatty acids. These are the building blocks that make the hormones, that make the enzymes, that make the chemicals that allow the body to work at optimal levels. And without these nutrients, the body can't operate like it could. And you can't do it with the Centrum Silver or one a day. That's the based on the RDA, which is the recommended disease allowance, right? It's just enough to keep you from getting beriberi or scurvy. It's really not going to do anything. And then last, you've got to fix any type of gut issues, because as you know so well as an expert in functional medicine, really the health of our gut, our digestion, our elimination is crucial for our overall health. So those four things really make up kind of the Murphree method, is focusing on those four things. And not to be too long-winded, I'm sorry, but the purpose of that is, if you've got 15 tacks in your foot and I pull out one or two tacks, you're not going to know much of a difference. But if I can pull out 10 tacks rather quickly, you're going to notice a difference. And these four areas, if we can fix these four areas, focus on those and start to fix those are the main driving underlying causes of the symptoms of fibromyalgia. It's, people want to do all this colon cleanses and parasite, I don't even know what all they want to do, but they miss the point. It really boils down to these four key things. If you get these right, you're going to find that you're dramatically improved.
Yeah, I think you are so right on. I mean, I'm living proof that you need sleep. Ask any obstetrician. They will tell you that it's just, you can't function long-term without good restorative sleep, because I think of sleep as like the beginning of your day. Like if you didn't sleep well, your day's going to go poorly, right? It's not the end of your day. It's getting restored to start your fresh new day. And so I think that if you really make that a priority and get some good restorative sleep, then you might actually have energy to move your body and prep your food and make good food choices, And I love that you are saying you can't just use the recommended daily allowance for vitamins, because like you said, that is just the minimal dose that's going to prevent a really bad disease. It's not our optimal functioning dose. The ranges that we use developed back in the 1950s those are way off. So I think having a pharmaceutical grade, supplement that we know is efficacious is actually going to optimize your levels, I think you're right on with that, because some people just think vitamins are, I don't know, make you feel good or whatever, but they're like necessary cofactors for your enzymes and your hormones and your neurotransmitters, right? I think even doctors, conventionally trained doctors, forget how important and essential they are. So I love that you actually address that. That's great. Do you do testing with your patients, or do you just go by symptom management, trying to get to the root of the cause?
No, as a functional medicine practitioner, I really believe you need to test. I think really, ideally, that is um, the way to really define what's going on. If you don't test and be thorough with your testing, it's a lot of guessing.
Mm-hmm.
And people can read my book, and the Murphree Method is discussed in there. It's called the Jumpstart. It's part of a spinoff of the Murphree Method called the Jumpstart Protocols, which you can do it yourself. But really, for the complicated patients that I work with, who work with me one-on-one, I'm blessed to work with patients all over the world, but by phone now, and they really need testing because, as you know, just like you mentioned, Hashimoto's. I mean, Hashimoto's is something that's missed. I mean, chronically missed in conventional medicine. I find that I have so many patients who have the beginning of Hashimoto's, and it's never been found. Their TSH, the thyroid stimulating hormone, which is a normal test done by most doctors for thyroid, that's normal and can be normal for years until your thyroid eventually burns itself out. Then and only then does your TSH elevate, and then they say, oh, gosh, you got a problem with your thyroid. We got to put you on some Synthroid. But that could take years, as you know. So I really believe that testing is really important. Yeah.
Yeah. And meanwhile, you're feeling horrible all those 10 years, right? Because even though your levels are in this so-called normal range, your cells can't hear the signals, they can't utilize the hormones, so nothing's optimized. And I think that's such an important point. Like, someone might say, well, I've had that tested and I'm fine, but have you had it tested appropriately? So I think if people have been told that they're fine and they don't feel fine, they need to keep searching, right? They need to seek someone like you out, because there are other ways of looking at it and getting to the root cause. It's so important. I can't emphasize that enough.
Well, so if they come to see you and, they're working with you, they're going to get a very thorough thyroid panel. But most people, when they go see their doctor, and I hear this over and over, they go to the doctor and their hair's falling out. They get maybe the lateral third of their eyebrows are thinning out, their head of hair is thinning out. And as a woman, I mean, that's, it's terrible as a man, but as a woman, that's really, shocking and frustrating, and can be, create a lot of inner stress for sure. But, and then they have no energy. Maybe they're gaining some weight, dry skin, brittle nails, constipated, all the things that go with low thyroid. And their doctor, he or she, says, oh gosh, you've got all the symptoms of low thyroid. We're going to, let's do a test. I think you might have something wrong with your thyroid. Then they do the TSH and then maybe T4. That comes back normal, and they tell them, hey, good news, everything's normal. And then the person's left with, well, what the heck is the matter with me?
Right.
Right? So for my patients, I know, like we've had this conversation, when you're getting your thyroid tested, you really want to check free and total T4, T3, TSH, T3 uptake, reverse T3. Now, a lot of people, talk about that. And then check for thyroid antibodies. I think everybody needs to have their thyroid antibodies checked, and have them checked periodically if they have a real chronic illness.
Mm-hmm. Exactly. You need to know if your body's attacking your own thyroid. That's a big deal.
Yeah.
And conventional doctors aren't trained to check that because there's no pill to treat it, right? So that doesn't mean it's not important, and that doesn't mean there aren't treatments out there. I will tell you myself, just removing gluten from my diet saved my thyroid. Like my immune system stopped attacking it, and now it functions on its own, and it's amazing just by doing that one thing, you know. Are there any specific diets that you recommend for all your patients, or is it pretty individualized?
I think, Tabatha, that food allergies are the great masquerader of all
Mm-hmm.
symptoms. And having said that, I think that if you got a chronic illness, you want to know what it is that it's helping trigger or fuel this chronic illness and these symptoms. And one of the things that can do that is just the foods that you eat every day. I mean, you contact the world from outside, gets inside by the foods that you eat or drink. So if they're working with me, then I do food allergy testing. I do the ELISA test to look to see if they have any delayed sensitivity allergies to foods. Um, in my book, I talk about just doing an elimination diet. So I encourage everybody to come off all dairy, all gluten, so wheat and barley and millet and spelt and rye, all nightshades, which are eggplant, tomato, potatoes, tobacco. Try to steer clear. Can't do it, but try to get as much sugar out of your diet. No artificial sweeteners, no eggs, no citrus. And so people say, oh, what am I going to eat? What am I going to eat? We look at all those vegetables that are out there, and we're not taking away any animal proteins other than dairy. So you certainly, you can certainly have chicken and beef and those kind of things. But what people find, and I'd say probably 70% of the people that do the elimination diet, they're going to find one or more food or food groups that when they go off of them and then they re-challenge them in 3 or 4 weeks, they add them back in their diet, they get a negative reaction. And that could be something subtle like bloating and gas, or it could be something very dramatic like a migraine headache. But until you know that, you don't know, right? And the only way to know is to get it out of your system and then to challenge it back in. And I find that when I'm working with my patients to do the food allergy testing, they go, depending on what their results are, they may go off these foods for a month, or if it's a real severe allergy, may go off 3 months. But over that period of time, as we're working to get them healthier and healthier and healthier, they can add back typically about 90% of those foods back. However, there's typically going to be a couple, and sometimes that is gluten, especially with Hashimoto's, as you found out, that they can't put back in their diet. If they do, it doesn't take very long before they realize that it's got them back in a flare, got them back into the symptoms that they're trying to avoid.
Mm-hmm. Yeah, and at that point, it's a lot easier to avoid those foods because you have that negative association with how you feel, right? So I find the elimination diet super empowering. I just think it's a great reset. It calms your immune system down. You start to feel better. And then when you reintroduce and you have those negative symptoms, it's so much more obvious. And then you can feel empowered to be like, okay, I'm going to choose not to eat that anymore because I have control over how I feel, And I just find so much power in that. I think it's a great way to do it. So yeah, I usually do that, or with the food sensitivity testing, see what is your immune system reacting to, right? I mean, we really do need to calm the immune system down. I think that's key.
Yeah. Well, especially in fibromyalgia, because it's overreacted, and can be overreacted, whether that's Hashimoto's or some of the other issues that are going on that the body's attacking itself at. Yeah, definitely. I think that food is our medicine, right? And, let food be your medicine. That was a very wise saying. The thing about diet, though, for most people is it's the long game. It's not going to, you're not going to see results into, a week or 2 or 3. Now you can lose, if you're trying to lose weight on a keto diet or, some of these other diets that are out there, which are fine, definitely you can lose weight on. But as far as really dramatically improving the symptoms of a complicated illness like fibro, it's that you can't get well without doing it.
Mm-hmm.
You're going to have to do some other things as well to make it all come together.
Yeah, it's like a multi-system dysfunction. So you got to work on all the areas, right? So that leads me into your summit. Tell me how you have people from all specialties chiming in to teach people about fibromyalgia, right?
Yeah, it was so much fun. It was so much fun doing it, getting to meet people like yourself, and just having really stimulating conversations. Because sometimes I think we feel like we're kind of on an island. The kind of medicine we do, which I call good medicine, Jeffrey Bland, other functional medicine, that's what he called it. And Sidney Baker was another one. They talk about good medicine. And sometimes it's easy to feel like you're all alone in this universe trying to spread this message about this new form, but it's going to be the form of medicine eventually. But you feel like you're all alone. But I will say this is that I think the public they're demanding this. They want what you teach, the way that you practice. That's what they're looking for. They're looking for somebody that can help them navigate their health and not just give them a pill. That's that passive type of therapy, I think is eventually is going to go away. I hope. Yeah. You're getting more and more people that are proactive and they want to know, Dr. Barber, what can I do that's going to allow me to, to think better or have more energy or to sleep better. And then when you start to mention, Ambien or, that's not what they're looking for.
Yep, you're right on.
Mm-hmm. So. Yeah. But the summit, the Fibro Summit, I'm real excited. Dr. Barber's on here. She's doing one on hormones, talk all about hormones and some other issues and fibromyalgia. Then I have Dr. Christine Christensen. She's talking all about mold. She's a mold expert, which is fascinating. I don't know about you, Tabatha, but up until every once in a while I get a patient that had some mold issues. You keep, they're not getting better, so you keep investigating. And I'd run into that. But it's funny. I think the universe kind of brings you these cases in succession. Once you get you get kind of better at it, then they start coming. And I think something about the universe is setting you up in a good way that, okay, I can handle that. Sure. And right. Then, they find you, right? So mold expert, we do 2 presentations, one on Hashimoto, so all about autoimmune thyroiditis, Dr. Ina Topler, and then Dr. Justin M. We go into all about thyroid issues. Dr. Kaplan, she's just a world-renowned autoimmune doctor, but we talked about some autoimmune issues, but we talk a lot about this thing called adrenal fatigue. When, you get up and go has got up and went, and you find you really can't handle stress. Stress becomes really magnified because you can't handle it. Mm-hmm. So we talk about that. But, I was just really fortunate. I really got to meet some amazing practitioners, and there's information about SIBO. There's information about interstitial cystitis, which I know is a big thing in your specialty. Pelvic pain, we talk, so there's so much stuff. Yeah.
I'm super excited. I think that's going to be so great for everybody out there who are looking for answers. They're feeling frustrated, right? And the summit is free to watch, correct? And we'll have the links out there. The links will be in the show notes for this podcast. And then, if you feel like you want to work one-on-one, you work one-on-one with people, right? If they want a deeper dive.
Sure, absolutely. So they can, learn more about me at yourfibrodoctor.com. There's all sorts of free resources on there, blogs and videos and all sorts of great things that are available just to check out, just to see if it's something that can benefit your health protocols for people to take advantage of.
Perfect. Where else can they follow you at?
Well, so one of the things, if you do have fibromyalgia, that I would encourage you to do, along with taking advantage of the free summit. That's just going to be a wealth of information
right.
You can take advantage of. The other place is still at yourfibrodoctor.com. But if you go to my store, Your Fibro Store, if you look at there's some free videos on there that are called the Jump Start videos. And those videos, they're about 10 minutes each, but what they're designed to do is explain who gets fibromyalgia. Well, what is fibromyalgia? Who gets it? Why do they get it? And then more importantly, what you can do to start to overcome it. And then it goes into what is, why is deep restorative sleep so important? And then I go through all the protocols. And then why is it important to have the right combination and dose of these vitamins and minerals, amino acids, and essential fatty acids? And I talk about that in the protocols for that. And then all about adrenal fatigue, why you need to fix that so you don't have fibro flares, you have more stamina and resistance to stress, have more mental, physical energy. And then last, it's protocols all about digestion, elimination, in particular about irritable bowel. But if you have fibro, I really encourage you to watch those videos. And then if it resonates with you, there's the protocols are there. You can buy you can get the supplements over the counter. You can find them different, they're different places. It's just a great place to get started.
Awesome. Well, thank you so much. You're a wealth of knowledge and I think an amazing resource for women. So I'm really glad that you came on the podcast.
Oh, well, thank you so much, Tabatha. I mean, I always say that, I'm just really lucky to have met so many people just like yourself. I mean, if you are the doctor that people are looking for. If you are, female and you're looking for an OBGYN, to find somebody with your knowledge and talents and to be open-minded in conventional medicine and functional medicine, it's like trying to find a needle in a haystack sometimes. They found you, so it's just so great that they've got you to have as a resource. And thank you so much for the podcast and having me be on it. I'm flattered. Thank you.
Oh, yeah, anytime. So you're always welcome to come back. This was fabulous. I'll make sure I have all the links for your site and everything in my show notes for my listeners. And I'm excited to see the Fibro Summit. So September 28th through October 4th, right?
That's it. Yeah, great. Thanks.
Awesome. Okay. Well, take care.
Thanks. You too.
Thank you so much for joining me on today's episode. I hope you got something out of it. It's really important to understand the difference between conventional medicine and functional medicine. There is a time and a place for conventional medicine, but when you're dealing with chronic disease or diseases that have made their diagnosis based on a constellation of symptoms, then you need a functional physician who will get to the root causes of the issue so that you can actually fix the problem and it doesn't keep recurring, or if it does recur, you know what to do to get that back into remission. Such an important distinction. I really want you to take one golden nugget of information from this episode, add it to what you've learned from the prior episodes, because I promise if you make one little change, one little baby step every week and are consistent with your changes, they add up. And it's not a 1 + 1, it's exponential. They multiply upon each other, and you will reclaim your health and get back to being the amazing woman that you're supposed to be, right? So that is my goal for you. But I need you to do the work. I need you to find what needs to be dealt with and start working on it. Please don't hesitate to shout me out on Facebook or Instagram at Dr. Tabatha. That's 3 A's, no I, Tabatha. Tell me your questions. I am here to serve you. I honestly do this for you. I don't get paid. This is, not my day job. I do this as a side hustle because I have a strong desire to help you. I want you to live your best life. This is a sisterhood, not a competition. We're all in this together, and I just want to lift you up and help you be the amazing woman that I know you can be, and I want you to believe it as well. So please shout me out. If you tag me and share my podcast, I will send you a free gift. That would be so amazing. So thank you so much for trusting me to be your functional gynecologist, and go have a kick-ass week. Bye.